Hello friends, welcome to my YouTube channel. Today we will talk about the how severely finger can be reattached. Reattaching a severely finger, medically known as replantation. It's a complex procedure that requires prompt and specialized medical attention. The success of reattachment depends on several factors, including the condition of severed finger, the time elapsed from the injury, and the overall health of the patient. The general steps in this procedure is as follows. Number 1. The preservation of the finger. The most crucial factor for the successful reattachment is the preservation of the severed finger. It should be kept in cold but not in contact directly with ice, as ice can cause damage to the tissues. Wrapping a finger in a clean damp cloth and placing it in a plastic bag is a recommended method. The bag can then be placed in an ice container after that procedure. Number 2 is emergency care. Seek emergency medical attention immediately. The quicker the finger reattached, the better the chances of success. Number 3. Evaluation by medical professionals. Once at the hospital, medical professional will assess the condition of the severed finger, the extent of the injury, and the overall health of the patient. Number 3 is the cleaning and preparation. The severed finger and the amputation site will be cleaned. Damaged tissue may be trimmed to facilitate the proper reattachment. Number 4 is bone flexation. If the bone is fractured, it may need to be aligned and stabilized using small pins, wires and screws. Number 5 is artery, vein and nerve repair. The surgeon will meticulously reconnect the arteries and vein to restore the blood flow. Nerves may also be repaired to improve sensation and function. Number 6. Tendon repair. Tendons responsible for finger movement may be repaired to restore the functions. Number 7 is skin closure. The skin is then closed. The finger is splintered to provide stability during the initial health period. Number 8 is follow-up cares. After the surgery, the patient will require close monitoring and follow-up care. Physical therapy may be recommended to facilitate recovery and improve functionality. It's important to note that not all severed finger can be successfully reattached and the outcome can vary. The success of reattachment depends on various factors that already we talked about. If you like the video, hit like button and subscribe my channel. Thanks for watching.